Hi
Hello,
everyone. It's Krista and
Cassie.
Cassie. And welcome again to our podcast. And today we're going to be talking about autism. And I have four kiddos who have autism. And I know, Cassie, you have a son who you're taking to um, being evaluated, right?
Correct. Yep.
Okay. So in case anybody did not know what autism is, what it is autism is also called ASD for short. It is a distinguished by a wide variation of social communication and clinical behaviors that are considered somewhat out of character for children. But every autistic individual will experience different symptoms. So not every autistic child is going to be the same or adult. Um, some of the symptoms are developmental learning delays, difficulty communicating, difficulty in social situations, attachment to unusual interests, difficulty understanding emotions. That's a huge one in our house. Over or under sensitive to light, sound, touch, and taste. That's another one that we have in our house. Repetitive movements and behaviors. That's in our house as well. Trouble with transitions, that's another thing we have going on, and reoccurring sleeping problems, we have that, and insufficient impulse control. Now, the other thing I wanted to stress out to let you all know is that there are things that autistic children want us to be able to understand. And this took me a while, and I live by this in my house because it's important for me to remember, and my husband, because we have autistic children, what they want us to know about them. So if you have a child that is autistic, the first and foremost is that autism is just one aspect of their character. Ordinary sight, sounds, and touches in everyday life that are normal to us may not be normal to them. And
Hmm.
um, it isn't that I don't listen to you. It's just that I can't understand you. And that happens a lot with my kids. I like routines. That's a huge thing with autistic children is making sure that you have a routine because my one daughter has to live by the routine. And then when I say I'm going to do something with her, like it could be simple as we're going to take our bath now. She wants to go take that bath then because if I
Right then and
don't do
there.
it
Yeah.
at that time, she gets upset about it. So that's
Yeah.
important. And it could be something simple like that. And you don't compare, another thing they don't want you to do is compare them with other children, of course, because they're special in their own way. It's hard
Absolutely.
for them to tell you what they need when they don't know the right words to say. That's very common with autistic children. They don't know how to express themselves in certain situations. And that's where it's hard for them when they go into a school setting with socializing with other kids because the other kids don't understand what our kids are going through or your
Right.
children are going through. It's important also to be patient and to listen and to learn because we're constantly learning.
That's the
It's
biggest thing.
never
I agree.
ending. Yes, constantly learning. And also, they want you to focus on building what they can do rather than what they can't do. So, like in
Do.
our
Yeah.
house, my oldest son is in karate. He's going to be 21 and he teaches karate. He's been in karate since he was in second grade. He's going for his fourth degree black belt. This is his passion. So me with my kids, and I'm like, oh, he grew up so good. It was great for him. He has such a great experience. He's an instructor. This is his job now while he's going to college. He loves it. I'm thinking, oh, they're all going to do karate. No, 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 no,
Hmm.
no. That did not happen. So my expectations were, so our expectations were like not the right ones for them.
Hmm.
So we had to learn to get into what get them into what they're interested in, which is not easy. It's hard with some things
Especially with
because
so many kids now.
yeah,
Absolutely.
yeah. And the other thing was that they feel that they want to be with others, but they don't know how. So like,
And yeah,
yeah, it's really hard because like with the like you with Bryson, me with Elijah, I mean they have the same type of behavior.
personalities.
So
Yeah,
when they're around others, sometimes they're not good with the others because they may be acting a lot younger than they are than their own peers, or they could be acting too smart. It could be the other way around. Um,
right.
or they'll go and do something and the other kids don't understand why they're doing it and they'll make fun of them or stuff like that. And that I've seen a lot with my kids when we go. I mean, my kids, I homeschool, as you all know, but when I go to the park with my kids, which we do often because of the socializing, I want them to be able to be with around other kids and stuff. So we go to the park, we try to do other things so that they could be around other kids. And when they are with other kids in the park, like Elijah will go hang out with the older kids.
Mm-hmm.
He wants to hang out with the older kids because the younger ones that are his age, because he's so smart, that they can't communicate with him
Right, they can't
the
relate
stuff
with each
he's
other.
interested in. Yes. Like
Mm-hmm.
they don't even know what he's talking about sometimes, you know?
Right. Yeah, no, I see
So,
that with Bryson a lot too. Um, he's kind of on the scale where, like, he's definitely interested in things that are something like a much younger kid would be
yeah,
interested. Like, so 12, I would compare it to like something that like an 8-year-old would be interested in. So, like, when
right.
he talks about the stuff at school, the other 12-year-olds are like, we stopped liking that when we were like in second grade. And he's like, oh. So, what I found him like doing is like, he kind of mimics other kids.
Right.
So, to like fit in. So he's doing all of these things and he watches what other kids are doing and how they're behaving and then he like adapts to that personality, which gets him in a lot of trouble. And I
Yeah.
saw that like firsthand. We went on a field trip on Thursday and you know, this whole year I've heard nothing but like, oh, he did this today, he did this today, and I'm like, it doesn't, like, I don't know why he would do that. And
Right.
then being at this trip with all these other kids, I'm like, well, now I see why he's doing it because he's mimicking what he's seeing. And the
Right.
kids that he's mimicking do things on a much quieter scale, whereas Bryson's a lot louder about things that he's doing. Like,
Yeah.
it's noticeable when he does it because he's louder and he doesn't like have the mentality to be secretive about it.
Right.
Where I saw like a lot of kids were doing things they shouldn't be doing, but on a much quieter scale, so it went unnoticed.
Yeah. That's my
But me,
Chloe.
like, just, sitting next to him and observing that, I'm like, well, this makes sense.
Yeah, it
And that's
does.
so frustrating. And
Yeah.
that these kids feel like they have to adapt to their surrounding and kind of change entirely who they are to
Yep.
be accepted by kids their own age. So Bryson would definitely rather hang out with, you know, either like my stepson or my nephew because they've known him his entire life so they understand
Right.
him,
They
or
understand.
he wants to
Yeah.
hang out with people that are older.
Right. Exactly.
So
Yep.
that's tough.
Yeah, that's what's wrong with Chloe too, because Chloe acts a lot younger than her age. And then like when she's doing stuff like I was telling you before, I think I said this last time, I'm not sure, I don't remember, but like she'll play with Shay, who's 7
Hmm.
going on 8, and he's 10, going to be 11. So
Yeah.
they get along so much better. And like her and Lillian get along better, where like Zoe's the only one that is not autistic, and she is like way above her years with her age. Like she
Hmm.
acts like she's like going on 20 and she's not. So like, it's just it's hard for her because of that. She's trying to like fit in with just her sisters, and her
Right.
brother. You know what I mean? Even just
Yeah,
doing that is
absolutely.
hard. Yeah,
Yeah, it
because
can be.
Elijah's like so smart, and then like when Chloe will go and do something, and then Elijah thinks it's stupid, oh, it's so stupid. Why are you doing that? So dumb, you know? And I'm like, no, stop saying
It's
that.
not dumb to her.
Because it's not to her. And like I
Right.
have to constantly, in this house, we have to constantly make them aware of each other and each other's issues and problems because they need to know and they need to be more sympathetic to one another
Yeah.
and
Yeah,
treat
and
each
it's
other.
that's learning experience for them too. Like we are always saying how we're learning and we're trying to teach people around us about them, but we always have to stop and remember like they're learning
Yeah.
social norms too, and especially kids with autism struggle with social norms. So
Yes.
it takes a lot more for them to learn it than
Yeah.
anyone
Absolutely.
else.
Yep. Absolutely. Because like I even noticed that with Shay and Shay's just like she's always like I don't know how to explain it sometimes, but she gets in her like she's repetitive. So like she's
Hmm.
constantly saying something over and over and over again. Or if somebody, even if it's not her and it's like Lillian or it's Chloe or it's Zoe and somebody forgets to do something that I told them to do a while ago,
Yeah,
she'll come
she
up to me and be
remembers.
like, Mommy, you remember when you told boo 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 to do this or to do that?
Hmm.
They didn't do it yet, Mommy. And I'm like, it's okay, Shay. I'll handle it. It's okay. Because she wants it done, or she thinks, I should say, that it should be done
Right
when
when you
mommy
say it.
said it, but sometimes it's not possible,
Right.
you know, for them. Maybe
Do
they're
you
doing
find that
something
she
else or
also like? Do you find that she also like something that happened years ago, or like she'll remember and it gets her upset? Like she'll bring it back up?
no. No, that
No.
part, no. Mm-mm. That's one thing she don't like she remembers things, but it doesn't make her upset to the point where like it's gonna like, you know, make her get all riled up about it. But like
Hmm.
she like will remember things that happened a while ago and then she'll bring it up again. Like
Yeah.
with something when somebody got in trouble about something, she'll remember it. And remember when da da da. And I'm like, yes, but why are we bringing that up again? We
Yeah.
already talked about that, and that's done and over with.
Moved
You
on.
know,
Yeah.
yeah, stuff like
I
that.
find like kids I've know that have autism seem to, if like they're in a similar situation to something that happened a while ago, they'll bring it back up and be like, well, this happened. And a lot of the time, they can remember like specific dates, which is like crazy. Like
Yeah,
on
it
this
is.
day, June 24th,
Mm-hmm. They
2018,
do.
like
They
this
do.
this happened, and yeah, it's
Yes,
crazy.
it is crazy
Like
because
that memory,
Elijah,
I wish I had that memory.
yeah, like with Elijah, he's into like knowing dates of everything when something happened. And like he'll do his research. Like he knows when Mickey
Hmm.
Mouse started. He knows the very first Mickey Mouse cartoon that was up. He knows all about him. Like he'll tell you everything there is to know
Everything.
about Disney, Mickey, everything. Like it's just when he's interested in something, he's gonna go the whole mile to find out everything he
Yeah.
can about it, and he's gonna let you know about it. But like dates, that's a huge thing with him. He remembers the year when something happened. And like I go backtrack because I don't know. And I like I'm like, are you
Right.
sure? And I'll go back and I'll Google it. And I'm like, oh my God,
Yeah,
you're
you're right.
right. He's like, I told
Yeah.
you. And he gets so upset. He's like, I told you. And I'm like, I know, I'm sorry. You know, it's just
Yeah.
because like I can't believe that he's, you know, but like when they're really interested in something, they
Oh
will
yeah.
definitely remember and they
Bryson
do
does the
not
same thing.
forget. Yeah, they do not
Yeah.
forget. And like, I'm trying to think other like little quirks. Oh, well, I was telling you before we got on the our podcast about Chloe and like how she does her flapping.
Yeah, for stimming.
She does, yeah, she does flapping now. She just started doing that recently, but she has always rocked. That helps soothe her because she
Hmm.
always is trying to self-soothe, and that's her way to self-soothe. And she'll sing. Recently, her favorite song to sing is Jingle Bells. It goes,
Christmas all the time.
it's just, it could be anything, you know. And sometimes the kids get annoyed because she'll like be
Yeah.
right next to that, sitting next to them, whatever, in the living room,
Hmm.
and they're watching something together or whatever. And then she just starts, you know, and then she'll start singing the song, and then they're like, "It's getting annoying," and it's like, "Oh my gosh."
It's June.
It's like,
Yeah,
oh
I've
my
been
gosh, I
there.
can't take this. Yeah, it's just it's insane. And then like then you have Shay who, it's just like she gets aggravated when everybody else is doing loud things, but she
Hmm.
forgets that she's loud.
Very loud, yeah.
And then everybody always tells her, "Well, you're loud too, Shay," and it's like they get so upset and
Yeah,
it's
but
like
they don't realize that. Yeah.
yeah,
What do you
exactly.
think? Like, so since so your kids are diagnosed recently or when they were younger? Like, what were
No, they weren't young.
like the first couple of things you noticed?
It's been
Like, what made you
well,
think like I need to get them evaluated for this?
okay, well, first of all, it wasn't actually me that thought it. It was the therapist. And she's the
Okay.
one who told me, and the case manager who helps with the medications to make sure they're getting their medications and helps me with that and also
Hmm.
getting them into programs that can help them. She helps me with that as well because when
Okay.
you adopt from foster care, you get a lot of help, which is very nice.
Hmm.
Especially if the children are autistic or have any type of disability, mental, whatever it is, they will help you all the way through their entire life. The help will always be there. So they automatically have a therapist who comes once a week, who's been with them since they were young, since they were like
Okay.
3. I think she's been with since the youngest, well, Chloe was 2 and she was seeing a therapist. And then
Okay.
it went on from there. But I just got my kids diagnosed. Two of them got diagnosed first, and the first ones were Elijah and Lillian went first. And they were
Okay.
diagnosed. She said, I think they need to go because we noticed a lot of things with Elijah and was behaviors at school where we noticed there was an issue there
Hmm.
because he was so bored at school. He didn't like school, but he was smart and he knew
Right.
the work and was good at it. So we knew something was wrong there. And then with Lillian, she was failing. She was failing horribly.
Okay, so you had
Straight
two
up.
opposite sides of the spectrum.
Yes. And it was totally bad. And we knew that she was always out dazing, and they just didn't have the people that they needed at the schools to take care of my kids. And I didn't
Right.
expect them to. I didn't expect them to. That's my job as a parent. So it was like, okay, and when I took Elijah out, that's when Shay started kindergarten, was the same year. And she was running out of the classroom and
Hmm.
the therapist went there. Remember, we talked about that. And she saw how bad the
Yeah.
classroom was, and it was overstimulating. And that's when she said, "I think we need to Shay." So it was kind of like a trickle effect. First, it started with Elijah and Lillian. We took them to the neurologist. They got diagnosed. Then we went, but see, it's quick here. It's not
Yeah.
like in New
Right
York.
here.
I had one
Right.
appointment. One appointment.
That's amazing.
Yep. They put the cap on them for what is it called?
The EEG.
The EEG, the brain scan. They did that while we were there for 2 hours. And then we went through all the tests that day.
Oh wow.
And then as soon as we were done with the test, she came in and she didn't give me the actual diagnosis yet because they had to go through everything first and we had to wait for the
Right.
brain scan. But she went through down the list and she said, I believe that they are. And if
Hmm.
they are going to be diagnosed, it'll be mild to moderate or moderate to severe. And that's how we got the diagnosis. And then like 2 weeks later is when the brain scans usually come in, the results, and then that's when they tell you. And then what happened was is that after we had 3 of them done, Shay then went in after, and then after that I got Chloe done. Because I was worried about Chloe because like you, she was older
Yeah.
and I wasn't sure if they were going to be able to get a proper diagnosis for her.
Right. Yeah.
Because
It
she's too
becomes harder as they get older.
Yeah, so that's why we were like, all right, we have to hurry up and get this done. And my doctor, my pediatrician is so good about he- whenever he thinks something's going on and I say something to him or I mention it, he gives me the referral and he says, yes, take them, go, which is really
Yeah.
good
That's
because I know people have a lot of trouble with that too, where they can't get the
yeah.
referral to even take their child to be diagnosed because I'm
Mm.
telling you, the earlier you get them diagnosed, the better off it's going to be for them. Because then they're going to be able to get in place all that stuff that they need, which Shay needed speech therapy and occupational. Lillian needed speech. Now, Elijah didn't need any of that because he was too smart. He was on the other side of the spectrum. So
Right.
he was totally different. He needed the ABA, which is the behavioral therapy.
Mm-hmm.
So that was the only part that he needed. So as far as that went, I mean, and they still have their therapist. So, I mean, she's always going to be here. She's like family now, because she's
Right.
been with them since they were young. So, which we've been very lucky because I know a lot of times therapists come and go, and it's really
Yeah.
hard for
Yeah, we had
kids.
that. We've had that problem here, big time.
Yeah,
It's like
it's
they get
really
a new
hard.
job and they kind of just jump ship, and there's
Yeah,
not like even a. It's not even like a good transition.
no,
Like Bryson's seen, oh my gosh, 4 or 5 different psychiatrists since he started going to therapy at age 4. And like I find as soon as he like starts to really get comfortable with them, it's like, oh, I accepted a new job here, and like so now you'll be seeing whatever that is, and then he has to like start all over again, and it's so
uh,
frustrating because then you have, they're looking through the notes and everything, but you're like having to re-explain everything and tell them
right.
like what you see at home, and then like I think that is the main reason why it's been so hard to get an evaluation done because I had been saying it for years and they're in, he keeps getting, I just feel like they just kept adding more and more things onto his diagnosis, which sucks because once they're diagnosed with something, it's next to impossible to get that taken off.
Yeah,
Like it's always just going to be on their file.
yeah, it's always going to be there. Yep, that's what we were told
So,
too. That's why it's so hard because, well, for them, like we only went through two psychiatrists, so we were lucky there too. But
yeah.
the therapist was like, they had like Chloe and Lillian had a therapist from the beginning because of losing their mom the way that they
Okay.
did. And so they needed it right away. So they got it.
Hmm.
And as far as like Elijah, Zoe, and Shay, they didn't really need a therapist in the beginning because I had Elijah 4 days right out of the hospital,
Yeah.
and Zoe had it 6 months, and Shay had it 6 months, and they didn't know any different. They didn't know anybody else
Right.
but us. So they didn't really need there because they weren't going through anything like Chloe and Lillian went through. So it was a little bit
Right.
different for them. So they went through one therapist, which she was very good, but then they move on and do other things.
Right.
Like, you know what I mean? Like they get better jobs or they move up in the company or whatever, and they become psychiatrists themselves. So like
Right.
so now the therapist we have, Deanna, she comes once a week and she visits with them. Plus they have their psychiatrist appointment, which is once a month.
Hmm.
So they see
So when the
both.
girls were already in therapy, was there any indication that they would have told you then, like, we've noticed some symptoms in the girls being in therapy that there's a potential that
You know
you're
what the
going to be on?
funny thing is that when Chloe was younger, she had the rocking motions, she had all that, and we kept saying, is there something else going on with her? Do you think that there could be something else? Like, why is she rocking like this? Why is she doing this all the time? And they're like, oh, it's just a soothing thing. She'll stop when she gets older. That's what they used to tell us. And it used to aggravate me because I used
Yeah.
to be like, I don't think she's gonna stop. Because, we're the ones living with her, so we notice. Oops, I lost you again. Oh, there you are.
Yeah, you're there.
It keeps cutting out. I don't know why. We're having bad like reception today. But yeah, like I didn't think it was normal. Gordy didn't think it was normal. And they kept like putting it aside, like it's okay, she'll grow up, she'll be fine. It'll go away eventually, they thought, and it didn't. Now
Right.
with Lillian, there was no indication until she started getting older and until she started school. So when she
Yeah.
was in like pre-K, that's when we started noticing things with her.
When
And
she
then
got
she
around other
started the
kids and
rocking.
was like in a
And then I
social
thought,
environment.
okay, maybe she's just rocking because she sees Chloe rocking, because you don't know.
Yeah.
if they're just mimicking, I don't know. But
And kids with ASD are so good at masking their symptoms
yeah,
until they get into certain situations and then they don't know how. So, like when they're at home, they get used to the family life and they can mask their symptoms really well, but then they're put in new situations and they can't.
yeah,
And that's when you start to notice the little things that you might
yeah.
have missed when they were masking before.
Yes, and that's what was happening with Lillian because we weren't sure. So then when she was failing miserably in school and then, and they were, I mean, it couldn't have just been ADHD. I mean, there was
Right.
just no way. And then the teacher was saying how she was always daydreaming and never, and they had her on medication for focusing and all that stuff. And she still was not focusing. And then when the whole COVID thing happened, when we were home and I was doing school with her, I noticed that
Yeah.
when I was doing one-on-one with her, even one-on-one, I was having problems. So I'm like, if
Yeah.
I'm having problems just doing one-on-one school with her, she's never going to
Like
make
with
it in a
20
classroom
plus
setting.
more kids, yeah.
There's no way, no way. So that's how I knew that something wasn't right. And that's when, we took her too. So I was able to get her and her and Elijah in at the same time, which was great. And then, but then once we got them diagnosed, then everything, they got everything that they needed. And anything that I did need or anything that I do need in the future, that neurologist that they went to will always be there. All I have to do is call them
Yeah.
and tell them if there's something new and I need a different type of therapy or whatever. Like we're actually trying this when school starts here in August. So when they start school again, they get these grants because of their autism, and we're going to use the grant and we're going to use it towards horse therapy. I don't know if you ever heard of this, but horse
I
therapy is
have,
supposed to
yeah.
be the best therapy for ADHD, autistic kids, kids who have any Asperger's, anything. They and it's like not just riding the horse, you're taking care of the horse, you're feeding the horse, you're
Hmm.
brushing the horse, you're taking the horse for walks. It is like the best therapy in the world. And there's this woman here who lives nearby who has an actual place that she does, and she takes in mostly autistic children and she does horse therapy with them. And she's really, really
That's
good.
amazing.
And yeah. And so we're going to get Lillian and Chloe into that program and they're going to start it, which I'm very excited about because, especially with Lillian and Chloe, because Chloe loves horses. So she's going to love it just because of that. And then Lillian loves to be outside. She loves nature. She loves animals. So
Right.
she's going to love it. And this woman, actually, there's kids who have worked there since they were younger, and now she gave them jobs and they work there,
Oh,
which is
so
awesome.
that's like a stepping stone for them too. Yeah,
Yes, absolutely. It
that is
gives them
great. I've heard a lot
somewhere.
of good progress with even just like working with any animal specifically. Like I know the ASPCA and SPCA's also do like therapies with like dogs, and they let kids come in and read storybooks to dogs, and it's like very calming and
Um,
soothing.
that's
And
nice.
I mean, kids love that. It's like
Yeah,
something they can, you know, do, and they know they're not getting judged, obviously by an animal. So it's
right,
beneficial
exactly.
for the animal because the animal's getting attention, where they
Right.
might not always get so much human contact, and then the kid is also doing something that's enjoyable to them, which is great. I
Yeah.
love that kind of therapy.
Yeah, they say chickens too. Chickens are another great
Yeah.
animal, they said, believe it or not. I mean, I've heard stories where like the kids actually start talking. The ones that are nonverbal, they'll actually start talking. If the more they're around animals and stuff, it's just something about it. And I think it's awesome. And I think that they should have more programs like that for kids because with,
Yeah.
autism, because it does work. And I think it's great because I couldn't believe it when I heard about this horse place. And I heard about it through our therapist because other kids have gone there and they've seen throughout
Yeah.
the years how much progress kids have made with that therapy. And it's also really good for Chloe too with schizophrenia because she has childhood schizophrenia. And I guess it's another
Yeah.
good thing for them as well because
Kind of coping mechanism.
somebody
Yeah.
who's actually there and they're talking to the
Yeah.
horse and she,
Right.
and I think she's just gonna love that part.
I think so too. I couldn't imagine it going poorly. I mean, I don't know a kid that doesn't love animals. And
Yeah.
animals just have like a sense about them. Like they can tell when something's going on with a person.
Oh,
Especially
absolutely.
with kids. Like you see interactions, with your family dog. Like
Yep.
the way they will set their head on a person's lap when they're sad.
Yeah.
So like it's just that extra sense that I feel like animals have. And
Yep.
it really helps feel like understood.
Yeah, and that's how our dogs are. I'm telling you, they know when something's wrong with the kids. They know, like, Luna
Hmm.
will just start like Luna's so funny. She's a blanket dog, so she'll grab a blanket and she'll like put it in her mouth and she'll start like she'll start barking and like with the muffled bark and she's like looking at them barking like stop it. Like if
Yeah.
Elijah gets upset, she'll go up to him and start doing that. Like stop it
Hmm.
because it's
Yeah.
upsetting her. And then like Toby goes crazy, but Toby, my other dog, he has like total anxiety problems himself. So he like, he barks at anything. So like when he sees like Elijah acting up or anybody else, it could be Lillian, anybody, he gets upset and he starts barking.
Hmm.
So it's like
Yeah.
they know, they sense it.
Oh yeah. Yeah, our
Um,
younger dog, she just turned 2 in May, and when it gets like to the point where, Bryson is screaming or Leighton's screaming and they're upset, she will howl at them
See?
and
Yeah.
then like bring them a bone or
Yeah.
something
See?
like,
Yeah.
yeah.
That's how they do. And
So
it's incredible. I
you're
think
like, no.
it's just like I'm just like, and I tell them all the time now when they do it. I'm like, see, you're making the dog upset. Stop.
And most of
Hoping
the
that'll
time
work.
too, they're like, with it works with Bryson because sometimes he could care less if he's like making me upset or my husband upset.
Right.
As soon as I'm like, well, now the dog's upset. And then he's
Yeah.
like, no, 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 come here, I'm so sorry. Like, he's so much more empathetic towards the dog than he is towards people
Yeah.
in the house. I'm like,
Yeah.
okay, well, I guess whatever works.
Do you
It's fun.
notice like with Leighton and him when they like fight, is he a good like forgiver? Like say Leighton does something and then he does something back and it's both of their faults, let's say, okay? But then Leighton says, "Oh, I'm sorry." You know what I mean? And she's sincerely saying sorry. Like, does he like right away say sorry, or does it take him a while to get to that point?
It honestly depends on the situation. Their personalities, as far as that goes, are very similar.
Okay.
Um, Leighton is more of the one who doesn't accept apologies.
Oh,
Where
okay.
Bryson, it's like a 70-30. Like, if he's really upset at her, he's like, I don't accept your apology. But sometimes, like, depending on how it escalated, when he snaps out of it, he's usually the one who'll be like, okay, I'm sorry. And then she's like, well, I don't forgive you. And he's like, see, she never forgives me, but I'm always expected to forgive her. And it's like she's younger,
Right.
um, but I mean, they both hold grudges pretty good.
So they're both
They really
stubborn.
do, yeah, very. And you know, um, I think it just depends. Like if it's something kind of stupid, I find that it's not necessarily like an apology that they'll say to each other, but it's more like they're like arguing, and then an hour later they're like playing nice together, and I kind of count that as like that's the apology. Is
That's the
like
apology.
they're
Yeah.
laughing and giggling together and
Yeah.
having a good time. So clearly they're over it.
Yeah. That's what happens here too. Because I just like today there was an incident today. That's why I asked. Because Chloe got I don't know how the situation started. I wasn't in the room when it happened. So, it's always that way. So you don't know who to believe,
Yeah,
who's telling the
she's
truth. Yeah. Who's telling the truth,
right.
who isn't, whatever. I didn't care. I said, you're both at fault. They both hit each other. I'm like, you're both at fault. Nobody should have touched
Hmm.
anybody. And now you're
Right.
both in trouble. So then after, when Chloe realized everything and she realized it was the wrong thing to do, she's like, I'm so sorry, Elijah. Come here, let me hug you. And then she told him, come here, let me hug you. He was like, no. And
Yeah, yeah,
he's just like, no, I don't want your apologies. I don't want to hear you. I don't see you. Get away from me, And
yeah.
then I looked at Chloe and then she looked sad because he wouldn't accept her apology. And I'm just like, Chloe, honey, just give him a minute because, he's still really upset and you got to give him a little bit of time. And then
Hmm.
maybe he'll come around. We'll make sure, we'll check it out then. And she's like, okay, mommy. And then she goes and sits down. But you could tell she was hurt,
Right.
because she's the type of kid that she's very like affectionate and like she's not like Elijah where Elijah's like, you know, he's so
I don't
stubborn
want to be
and
touched.
it's just yeah, and she just was really sad about it. But when I finally sat him down and I just like kind of had like a heart to heart with him. And I was like, Elijah, do you think acting this way is going to be a good thing? Because
Hmm.
it's only going to make me more upset. It's going to make dad upset. It's going to get everybody in the house upset. I'm like, because you're just going to, make everybody upset because you're still upset. So do you think it's a good thing to stay mad, or do you think it's a better thing to be nice and accept her
And let it
apology and
go.
maybe you say you're sorry and just let it go? Because he never wants to let it go. Never.
Yeah.
Like, if I could just get the kid to let things go, the house would be like amazing.
Yeah. No, we have that issue here too. Um, both two out of three kids hold on to things here. So
Yeah,
Leighton and
see, so
Bryson have a hard time letting things
Yeah,
go.
it's
Yeah,
really
but
hard.
Bryson's more apologetic with like me. So like if he's been completely miserable to me all day and I'm just like whatever and just kind of ignoring it, at the end of
Right,
the night then he's like I'm really sorry for what I did and I'm like okay, well what specifically are you sorry for? Because I don't like fake apologies. Like you need to tell me exactly what you're sorry for. Like you can't just mold it into one thing. Be like, I'm sorry because you're starting to feel guilty. I want to make sure he knows what he's sorry for,
right,
not a general statement, which I feel like it's a defense mechanism to get himself out of trouble.
right.
So I make sure he like says exactly what it was that he was specifically sorry for. And I feel like it teaches him in the moment, like, okay, I'm sorry for yelling at you today for no reason. So then he kind of is taking on the responsibility of knowing what he did
Yeah,
was wrong instead of just
yeah,
saying, I'm sorry and doing it again tomorrow.
right. See, now that's what happens here too. Elijah will like the same thing. He'll realize it and then he'll say he's sorry to me a lot quicker than he will with any of the girls.
Siblings, yeah.
Yeah, yeah. So it
And
just
that's
depends
a
on the
lot of the
day.
time like an attention thing, I feel like too.
Oh, it's
Like at least
definitely.
here it's like fighting for parents' attention.
Oh yeah, that's what it is
So
here,
they
Jen.
don't want to like yeah, they don't want to like apologize to their sibling.
No,
Like they
they
can't
don't.
look like the weaker sibling or
Yep,
something.
exactly.
It's
Yep,
ridiculous.
it is. It's like who's,
It really is.
like Elijah doesn't even realize sometimes, like I'll say to him, like, that's your younger sister. Like when I'm talking about him and Shay, I'm like, that's your younger sister. You got to understand she's younger than you. So you need to be nicer to her and you need to be able to understand sometimes she's going to get you upset and sometimes she's going to nag you and bother you. That's what little sisters do. And then he looks
Yeah.
at me and he's like, she's my little sister. I'm like, yeah. I'm like, you're her older brother. And he's like,
Right.
I am. I'm like, yeah, you are. So that's a huge responsibility. And then when he finally
Yeah.
realizes it, it's like, where have you been?
A lot of the time I feel like kids with autism and ADHD, like they really do have such a hard time with like, obviously like, social cues, but like social responsibility. So being the older sibling, that's not necessarily something that they're thinking of, nor do they really care about.
No, they don't.
They care about like what they're interested in, what they're doing at the time, and then when you sit down and explain it, you can really tell that they struggle with that concept. Like, oh, I'm
Mhm.
supposed to be the good example for my younger siblings. It's
Yeah.
totally not what they think about at all. It's
No.
like something that's far in the back of their mind, and then when you talk about it, they're like, oh yeah, and like they understand it in the moment, but I feel like it kind of just will dissolve away as time goes
Yeah.
on again until you have the conversation again.
Yeah.
So It's definitely, I think, part of that, like understanding emotions, understanding social responsibilities. They have a
Yeah,
difficult time with that, and a lot of
yeah,
people
it's really
don't
hard.
always get that part of
Mm-mm,
it.
they
Yeah.
don't, and we notice that a lot here too, because it's just like I don't know what they're thinking sometimes. I'm like, it's common sense, you guys, but they don't, they could care less, you know?
Yeah.
And then I
Not to
always tell
them,
them,
though. Yeah.
you guys are supposed to be looking out for each other. You guys are supposed to be like, I don't know, when I was growing up, all my cousins, your dad, who was my dad,
Yeah.
we all, they would never let anything happen to us girls. They were always there. They always had our back. That's how we grew up. It was just,
Hmm.
you know what I mean? That's how I want my kids to grow up. I want you guys to have each other's back. I want you guys to be there for each other. You know, you guys have your family that's like bigger than anything. Come on. And getting that through their head sometimes is very hard because they just don't grasp it. But I think if it ever came really down to it, God forbid, and something like that happened and they were being picked on or bullied or anything like that, I think they would definitely have each other's back because I think
Oh,
they
I
would
will definitely
that's
say
it.
that is so true because that is one aspect that I see in Bryson and Leighton and Hunter's relationship is Bryson plays the role of protector when it comes down to those situations. If he is in school and he walks past Leighton's classroom or she's in the cafeteria and she looks upset, he'll go right to her to see like what's
Um,
wrong. And then
oh,
she's like, so and so said this to me or did this to me. He's like, who? Which one is it? And he's like ready to fight for her. And I'm like, Bryson, I love that you want to protect your sister and make her feel better when she's upset. But
right.
you're 12, and the kids that she's not getting along with are 7 and 8.
Yeah,
So
they're too
you
young.
can't be doing that. So,
Yeah,
like, and like, same thing, like, we've seen like, on the playground. Some random kid is being mean to Leighton and Hunter. Bryson's the first one to interject and defend them. Like, he
that's
is,
awesome.
it sounds bad to say, but he's ready to fight someone at any given
Yeah,
time for
that's
them.
awesome.
So it's
Yeah,
like it's so weird because when you see them together in the house, you would never expect that. They
right.
fight so much, you're like, God, when are you two going to get along? But when it comes down to it, if it's someone else doing it to them, he wants to protect. If it's him, it's like, whatever. So it's just like so weird. I'm like, you guys don't make any sense at
They
all.
don't.
It's the
They
most
don't make any
thing.
sense. It's like don't even try to make sense because
No.
it's just too much. Yeah, I see it
Right.
all the time in them too. But like yeah, but I mean like other things that they do like with each other is like Zoe is like doesn't have any of that type of behaviors like they do though. She's like the one
Mm-hmm.
that's like kind of like just totally different. And she doesn't have any like repetitive things or she doesn't no like we never even like had an inkling about her having any type of autism because she
Yeah.
was just totally different from them. But like with the other kids like they're all different and they're all unique in their different ways. And like the things that I will say about like that has brought out really good stuff about having the autism is that like Elijah's really smart and he's really good with math and he absolutely loves to draw. He's real
Mm-hmm.
creative. He loves crafting. Um, he's really good with gaming. As I already told you, he knows too
Yeah.
much about
Oh, yeah.
gaming, too much about electronics.
That
Um,
seems to be a hot topic for most kids, I feel like, that have ASD, ADHD type things. Any kids that are like neurotypical, video games and technology, like
oh
such
my
a
God.
stimulating activity for them. That's all, yeah.
Yeah.
And they really do like dive into those things and want to figure every little teeny thing out about it.
Yes. Yeah. And like Chloe's really good with like she loves sewing, she loves to craft, she loves drawing, um she loves animals. Um and then Lillian, of course, we know she's the bug lover, you know, she loves to be outside. She's my nature girl, I'm telling
You
you.
don't hear that
That
much
girl,
about girls liking bugs.
wait, what did you say? I'm sorry, you're cutting out.
I said you don't really hear that much about girls liking bugs.
I know you know what though? I did. I went to the Dollar Tree one day and I bought her, the Dollar Tree always has cool stuff. So they had like this round plastic thing and each little thing had like a little cup in it and in it you could put different bugs and then it had a magnifying glass in it. Like you could catch the bug, put it inside your little thing that winds up and then you bring it around to the magnifying glass and you can look inside and look at the bug up closely or a leaf or anything, right? So I
Yeah.
got it for her. And when I got to the register, the woman working there, she's a young girl. I think she was probably like in her 20s, early 20s. And she said, "Oh my God, this is the best thing I've ever seen." And I was like, "Yeah, I'm getting it for my daughter." She's like, "Oh, does she love bugs?" I'm like, "Yep, loves bugs. I can't pull her in from outside." She's like, "That was me when I was growing up." She goes, "And now
Wow.
it's my daughter." She goes, "We both loved bugs." And she goes, "I still do." She goes, "I'm
That's
not
amazing.
afraid of them." And she's like, and I was like, "Yeah." I was like, "I think she's gonna grow up and like do something with that." And she's like, "Yeah." She's like, "Whatever you do, don't stop her. Let her go with it."
Hmm.
And and I was explaining to her, I said, she's autistic. I said, and this is like one of the things that like is her passion. And she's like, "Oh,
Hmm.
you have to definitely let her go with that." She goes,
Yeah.
because she's gonna she's gonna just be something awesome one day with it. And I'm
Yeah.
like, yeah, I'm like, I could see her being a vet. I could see her being I don't know what they call those people though that love bugs, but there is a name for them. Only I can never
Yeah.
remember the name because I learned it on the Big Bang Theory. But yeah, there is a name for bug people that love bugs, and I think that she's going to do that.
Yeah. She started so young, absolutely. As she holds on to that passion as she gets older, I could definitely see, she's
Yes.
finding new
I mean,
species and studying new species.
yeah, and they say whatever they love doing to go with it. Just let them do what they love. She loves bugs. So it's like, I'm not gonna, have her stop doing it. But like she gets bit up. She comes in with so many scratches on her. It's like, what are you
Oh,
doing out there? I just can't believe it. And
discovering.
yeah, and like she's getting into like because here in Florida, every bush is basically hard and like bristly. So she's like rubbing against that, or she's like like she had the one day, I don't know what she was doing, but we have a wooden fence in our yard, and she kept going at the fence, and she came in the house with tons of slivers on her fingers. I'm like, oh
Oh,
my
God.
God. I was taking out all
Oh,
these
that's rough.
slivers. I'm like, oh, Lillian. I'm like, you can't go up against the fence and like drag your hands against the
Mm.
fence because that's how you're getting slivers. She's like, I don't know how it's happening. I'm like,
I'm surprised she wasn't crying.
no, she's not a big. That's one thing is like she's the only one I will say that when she gets sick or gets hurt, she don't she'll make a big deal.
She doesn't
Now
slow
this is
down.
the one that I told you about on the other one of the other podcasts that decided to do a backflip and
Oh,
hit her head
yeah.
on the side of the pool. It didn't even phase her. The girl was not crying or nothing. I was just like, are you
Mm.
kidding me? Yeah, where like everybody else, they would have cried or like,
Yeah,
yeah,
Bryson's
not her.
like that too. His pain tolerance is incredibly high. So when he's like saying he's in pain, it's when I'm like, okay, something's definitely wrong. Like he got blasted last summer in the face with a baseball at one of his baseball games to the point where
Uh-huh.
like he had the imprint of the laces from the baseball on his face, like in his
Ooh,
chin. And he didn't even like he played the whole rest of the game, and it
yeah.
wasn't until like so I wasn't at the game. He was with his father. Um, when he got home and I saw it, I was like, dude, the laces are imprinted in your face. It's like bruising in your face like that. So I had to take him, and the doctor's like, how is he even dealing with
Oh
this?
my God.
Because that's a bad contusion. They were afraid that he broke his jaw or like fractured something.
Yeah.
So they x-rayed it and then we had to take him to the dentist to make sure he didn't damage his teeth. Like I was like, well, they're not wiggly. And they're like, they don't have to be wiggly. It could be like in the root. So we had to get a mouth x-ray too. But like, I was like, any other kid I know would have freaking freaked
Yeah.
out from
Yeah,
that. And
absolutely.
he's just like, whatever about pain. It's very
That's
bizarre.
Lillian. Yeah, she just nothing phases that kid. I mean, but like she's very sensitive though. Like she'll cry like
Yeah.
if her feelings get hurt, but like not
Hmm.
physically hurt. Like she's just, I don't even know where she gets it from. It's just crazy. Because like, well, I mean, she's out there. She's not afraid of anything. So it's like, outside, like the girl has no fear. So it's like
Yeah.
unbelievable. Yeah. Where like Shay has no
I
fear
wonder if that's
either.
like that is an
That is a
autistic
thing where
trait,
they
like
have no
that.
fear.
Yeah.
Yeah. Because Shay
Yeah,
has
like
no
the
fear.
personality is there. Yeah.
Yeah. Like
Huh.
she,
That's
like I don't
interesting.
think they think of, well, of course they're not thinking of the consequences of what could happen, like we do. Like they're
That's the
erratic.
low impulse control. Yeah.
Yeah. So it's like, because Shay's just like constantly flipping and doing everything in the house all the time. And I'm just like, oh my God. Or watch this, Mom. And then it's like, I don't want to watch
Yes.
this
I'm like,
because
oh God.
I'm afraid of what's going to happen next?
Yeah, I'm gonna have a stroke. Yep.
Yeah. It's just unbelievable. But yeah.
It's so so stressful. So like that's how my kids are with like they just do things and they're like, especially Lan with her acrobat gymnastic stuff she does. Like I have like severe anxiety and I have OCD. So when
So
she
you're
does
right.
these things, I'm like
Yeah.
really stressed and I like really obsess about it and like my brain automatically is like if she does that she's gonna break her arm.
Mm-hmm.
Like you can't convince me otherwise. So I'm like always like please stop, please stop, please stop, and she's
Hmm.
like I'm fine. I do this all the time, and I'm like so stressed out about it, and I
That's how I
can't
am
like
too. Yep.
I can't even watch it. Like,
Yep.
I'm like I don't even
Me
want to
either.
do like I've seen
Yeah.
her do some questionable flips to where her arm bends really awkwardly, and I'm like,
Oh,
ugh, that's broken. That's broken. And she's like, I'm fine. And I'm like, oh my God. I
oh
can't.
God.
It's
Yeah,
so
no, I wouldn't be able to
stressful.
handle
I
that.
don't understand.
Yeah, that's
No,
what
it's
I
so
worry
bad.
about too, because it's like I must like almost every day say, I'm not going to the hospital today. I'm not going to the ER today. I don't
Yeah.
want to go. I'm not going. So don't do whatever you're going to do because
Yeah.
I don't want to go. Yeah. Or
Yeah.
I'll tell my
I
husband,
say
I'll even
that
tell
too.
him, your turn, you go to the hospital because I'm not going. It's like, I just
That's in
can't.
there for 8 hours. I
It's
told my kids that too. I'm
ridiculous.
like, if you do this and you get hurt and need to go to the hospital, we're not going today because I
Yeah,
told you to stop doing it
exactly.
and you didn't stop.
Yeah, it's like
They're
I'm
like,
too
fine, I
tired.
don't even care if you take me. That's Leighton's thing. It's fine. I don't even care. I don't even
I
care if
don't
you take
even
me.
care.
If I break your arm, fine. I don't even care. I'm like, okay, you're gonna care if it happens.
That's so
She just
funny.
does
Oh
it.
my God.
She just got that like. I find like both my kids are the type of kids that like have to do something to learn the consequence. Like if I tell them what's going to happen, they're like, "No, that's not true." And then they do and it does happen. I'm like, "See?" They're like,
Yeah.
"Whatever."
Yeah. They don't like
Like
when you're
I don't
right.
just say things
Exactly.
to say things. Yeah. Like I'm
It's
not doing it to
ridiculous.
be mean or because I really don't want you to do it. I'm telling you because it's going to happen.
Yep.
Like been there,
It's like
done that. I
like
know it's
like
gonna
we've
happen.
seen other people, it happened to them. We had friends, we
Exactly.
know. We've seen it.
Yeah, we were kids once too.
Yeah,
Like,
exactly. And they just think, we're crazy. We're just crazy.
yeah,
We're just
or
parents and we're crazy.
helicopter parents.
Yeah,
Yep,
exactly. But yeah,
that's
so
hilarious.
that's and that's another thing. Like they just have like no fear of anything either. Like that's another
Um,
thing that I should have said on here too. They don't have any fear.
and it's
And
like
they're
it could be a good thing, but like a bad thing at the same time. They
yeah,
may not have like an issue with public speaking, like they won't have that fear. They might be really great at it, whereas I could
right.
never like get in front of a huge crowd and like talk. I'd be
Yeah.
terrified.
Yeah, that's how I am too. But well, we're on here and we're talking. No. So
Yeah,
I guess
well,
we're not
I
that
mean, it's
scared.
just might be
It's a
different if
lot
we were in a
different
crowd of
though.
people.
Yeah, it's a little different, I think too. It's much different, really. I mean, because it's like we're
Yeah.
talking to each other, even though there's other people listening to us. So it's a little bit different than getting up
Mhm.
in front of people and trying to do stuff. But yeah,
For
um,
sure.
there was a there was some other things that I forgot to mention too, like the food sensitivities.
Yes.
That's another thing with Shay. She has trouble with textures of food. So, we've had issues with like feeding her certain foods, like she doesn't like certain kinds of foods. One minute she'll like something and then the next minute she don't like it anymore. She in the beginning when the food texture thing started happening and we noticed that there was a serious issue was when she would eat something and then she'd run to the bath she'd run
Throw
not
up.
to the bathroom to the bedroom and throw it up.
Hmm.
She would spit it right out and throw it up. So that was a huge issue. Um, and that's the one I think we struggle with a lot because it's like trying to find foods that she's going to eat that aren't
It's
junk.
impossible.
It's
Yep.
hard. It's very hard.
Yes, it is.
And
Bryson
like,
doesn't have a food thing. He's got a touch thing. So
yeah, that's
we
another.
noticed that when he was very young. I think he spilled some water or something on the table, and I had said to go get a paper towel to wipe it up. And as soon
Uh-huh.
as that paper towel got like really wet and soggy, he threw up.
Oh,
Like he could
wow.
not touch the paper towel. He's like, I
Yeah.
can't do it. And he's like, "Ugh, ugh." And I'm like, you're being dramatic. Just finish cleaning it up. He's like, I really can't. And he started crying. And I was like, oh,
Oh,
this is like
yeah.
a real big deal to you.
It's a big thing,
So
yeah.
we noticed that was touch, and then like jean pants, if they're too baggy on the bottom, they kind of like crunch up. He
Uh-huh.
can't do it.
Oh, wow.
He's like, I can't have my pants crunchy touching my ankles. Doesn't like that. And then sound
Wow.
is a really big one for him. And we found that out when he was like 3. We took him to the circus, and we're like sitting in the bleachers watching the circus, and everyone's laughing and having a good time. And I just like glanced over at him, and he was like full face tears, like
Oh,
covering
no.
his ears, right? And I'm
Oh,
like, what the heck happened? Like, did I miss something? And I'm like, what's wrong? And like, he couldn't tell me. So like, we left, and I was like, why are you crying? What happened? And he's like, it's just too loud. It makes me really sad. And
yeah, that's
that's
Shay
when we
too.
learned that. Yeah,
Yep.
we learned that he had. That's how he got diagnosed with sensory processing disorder. Was because of those things, and now we noticed he's 12 now. We actually had to request to have him pulled out of the cafeteria for lunchtime because it's so
So
noisy.
noisy.
And it wasn't that he was like crying, but it was a trigger to where he was like exploding, like
Oh,
aggressively.
yeah.
And like
Mm-hmm.
he was always like that's it was crazy. Like there was a 3 weeks time during school this year. Every single day at the same time, I got a phone call
Yeah,
that
see.
he's having to sit in a different room. Like he's having a really hard time. We can't get him back on track. And I'm like looking at the time, and I'm like, what is this period of the day? And they're like, well, it's during lunch. And I'm like,
Mm,
and it's really noisy in there. Well,
yeah.
yeah, I'm like, that's the problem. So
Yep,
now he
that's the
sits
problem.
in the office at a desk and has lunch in the quiet. And
Yeah.
since then, he's never had a problem with lunchtime. And I stopped getting the phone call at that time. So
Wow.
um, resolve that. But like anywhere that's crowded and loud, he
Yeah.
he doesn't cry anymore. But he definitely gets triggered, and it becomes like almost like a manic state where he's like either laughing hysterically, and you can see like his eyes get really big, and you can just see he's very overstimulated by all the noise. And we
See,
notice now
laughing
Leighton's starting to do that
hysterically.
too.
That's another thing, laughing
Yes,
hysterically. That's Shay. That's what she does too sometimes. She'll laugh
when she's
hysterically.
overwhelmed. Yeah.
Yes. That's so weird that you
Yep.
said that
Bryson
because,
does that
yeah, that's
constantly.
one of her things. Yep. And like you said, the
Yeah,
loud noises.
even when he gets in trouble. Yeah, if he gets yelled at for anything and we're being louder with him, it like snaps into like this manic, laying on the floor laughing hysterically while tears are coming out of his eyes.
Yeah.
And Leighton
That's
just
what Shay
recently
does
started
too.
doing that.
Like Shay doesn't laugh
Yeah,
hysterically
it's
when
so
tears start
weird.
coming out of her eyes, but she'll laugh. And I'm like, I don't, it's not funny, Shay, but that's just her reaction
Hmm.
to how we're
Yeah,
handling her. It's
yeah,
just,
and
she can't
even in
help
like a
it.
serious situation, yeah,
Yes.
Bryson
Yes.
will laugh hysterically. Like
Yeah.
everyone around him can be very upset with him, and I don't know if it's like because he doesn't know how to fix the situation and becomes really overwhelmed with emotions that
Right.
the output is just hysterical laughter. And then we're all sitting there like, what is happening right now? Like, and he will like be in this, oh, it's almost like a trance where he's just like
Mm,
laughing and you're like, calm down, like what is
right.
going on? Like cut it out. Like what is
Yeah.
like you need to tell us what's happening and he just will just sit there and he'll just laugh and laugh and laugh and laugh. And then he snaps out of it and he's like, I'm really sorry. And we're
Oh,
like,
wow.
what just happened? So like I
Yeah.
did, and that was like one of the things this year that I had mentioned to the psychiatrist. I said, you know, he's always kind of done it, but it's becoming more frequent as he
Right.
gets older. And she's
Right.
like, yeah, that's like an autistic thing. And that was like another push towards why she really wanted us to go get him evaluated.
So like when is he in the process of being evaluated or it's taking
Yeah,
forever?
so oh
Is
my
that what's
god.
happening?
It's absurd how long it takes here. So we have in our area really one place that does it. And that's our children's hospital here. So I actually that wait list is like 3 to 4 years,
That's
and I was
ridiculous.
like, "There's no way he's going to be like basically out of high school at that point." And there's another place which we're going through, which is like an hour and a half away,
Yeah.
and the process there is like 6 to 9 months, which is
Well, that's
better
a
than
little
3 to 4
better.
years.
Yeah.
But like just so, we got the referral from the psychiatrist. I had to call and let them know, like, I have this referral. What do I need to do? So then they send you, like, a packet. And, like, the parents have to fill something out. The psychiatrist has to fill something out. The pediatrician and the school. And it's, like, 5 pages of questions.
Yep.
Then they want, like, the growth charts, medication list, stuff like that. Send it
Mm-hmm.
all in. Then it takes them 3 months to read through those packets. Like, I don't know why it takes 3 months to read through a couple packets, but that's just what they tell you. And then after that 3 months is up, it takes another 3 months from that to get an appointment.
That's ridiculous.
And we're still, so I submitted the packet back in February. So
Oh
it's
my
been three
God.
months. And I called him like just last week and was like, what's going on? Like, did you guys finish this packet? And he's like, oh yeah, we do need like one more document. And I'm like, were you guys gonna call and ask me that?
Yeah.
Like I had to call because I was like, it's been 3 months, so I'm gonna call. It's like they were never gonna call me to say that. Like, how long have you known that you needed this one
Right.
document? And if I didn't
Yeah.
call, I would have never known that. So I got it filled out. I sent it back the same day, and I haven't heard anything. So I'm thinking I'll probably have to call tomorrow and see like what the status is because I'd like to get him in there if I have to drive an hour and a half during the summer when he's not in school because I hate that I have to pull him out of school for things all the time
Right.
because he needs to be there or else he's
Yeah.
going to fall behind. And
Right.
that appointment I will assume will take all day. Plus, with the driving, it's definitely going to be like a whole day.
Oh yeah, absolutely. Yeah, see
I don't.
that's
I couldn't even.
that's just not right. I can't understand that. I don't know why they do that there. I
I don't
wonder if it's
know.
like that in all these other states, and that's why these people are so frustrated, these parents, because they're just like,
Right, and with how New York State is, like, they're usually pretty good about stuff. You know, they're
yeah,
usually
that's
like,
right.
we're a democratic state, so, you know, it's much
Yeah,
more free than like a Republican state would be for a lot of
right,
things. But then
right.
it comes to stuff like this, you're like, where are the resources
It
for
has
this?
to do with
Because if we really
children.
only have two hospitals that are going to do it, that seems to kind of be an issue. You know,
Yeah.
like, why are there other places that can do this full
So there's
evaluation?
no like Nemours Children's Hospital near you?
No, we just have the one children's hospital, which is about 15 minutes away from me, that
Right.
has
That's where I was born, so I know
like an
Children's
outpatient.
Hospital.
Yeah, like
Yeah.
so they have an outpatient clinic now that's
Hmm.
connected to the hospital that pretty much does like all the specialties. Like they have the endocrinologist and the
I
orthopedic
can't
and all
believe
that
it's
is
four
in one
years.
building. I know. That's how many
That's
kids. That's like
insane.
how many kids are being evaluated, and it's like so that's fine for like if the kid's really young and they're doing early intervention, they can probably wait a couple of years. But when you have older kids, it's like by the time they're out of high school, they've completely conformed to like the norm. by that point. And they're
Yep.
going to become so good at masking the symptoms, you're never going to get the right diagnosis.
No, you're not.
And that's what's frustrating as a parent. Because I know
Yeah.
my kid masks.
Yeah.
So when, especially like he might not mask around me, like I pick up on things, but when he's around people he doesn't know or trust, great masker.
Really?
Really great at it. Like, never
Wow.
know. Yeah, because he literally can, he's like a chameleon. Is that what they're called? Those
Yeah.
lizards
Yeah.
that can change colors? That's like
Yeah.
him. Like, he can change personality to like
Wow.
fit in. Like,
Wow.
he's pretty good at it. So that's where I'm like concerned. Like, I'm going to take him to this evaluation, and he knows what he needs to say to like not be diagnosed right because he does it
Mm.
in therapy. So it's
Yeah.
really hard. Like they ask him questions, and most of the time I have to sit there when they have to ask him like the entrance questions because he's not honest. Because he
Oh,
knows if he is, what comes after.
what comes
And he's
after?
so
Yep.
tired of all the medications he's
He's
on,
tired of it.
he
Yeah.
doesn't want to be. So I'm like, no, Bryson, that's not true. And I always have to like interject with him. He's like, oh my God, I don't want another diagnosis. I don't want another medication.
Yeah,
And I
that's the
feel
thing
for him.
too. Yeah,
Yeah.
exactly.
I mean, the poor kid, he takes 5 pills in the morning, 2 in the afternoon, and 4 before bed.
Yeah. They
That's
get
a lot
aggravated.
of
Yeah,
medication.
it is.
Yeah. And he's like, why do I have to take medication to be normal?
Yeah.
I'm like, it's not to be normal, Grayson. It's just to help you be successful.
Yeah.
And he like gets it, but he doesn't. Because he
Yeah.
sees like everyone around him the same age that doesn't have to depend on medication to like
Right.
fit in, essentially.
Right.
And that's really,
Yeah.
I mean, it's really what it does.
Yeah,
Like
and
the
that's
mood
what I worry about
stabilizing.
too. Is like when they get older, are
Right.
they going to still take the medication? Because there's a
Exactly.
lot
And
of
that's
them
a
that
big
go off
problem.
of it. And that's a huge fear of mine because that's
Yep.
what happens. And especially with adults who are bipolar, they don't like to take the medications
Right. They don't think
that
they
they're
need it.
on. They don't
Yep.
think they need it, and that's what worries me. So yeah, it is a huge worry, and I can see where he's coming from
Yeah.
because I take a ton of medications for my MS. I hate it,
Hmm.
you know.
Yeah.
But the weird thing is that when I lived in New York and I got diagnosed with MS there, and I mean, they had everything for adults there. They have
Hmm.
all I mean, there was Jacobs Neurology Institute. Thank God they had it there because that's where I got diagnosed. That's where I got all my treatment. That's where I went all the time for my appointments and everything. They had tons of neurologists. I'm just surprised that they don't have that for kids, like a
Yeah.
neurologist for kids there.
I want to say, like, as far as I know, at least, there may be more, but like, the pediatrician, the only place they've ever told us to take him for neurology for like EEGs and MRIs um, was we have dent neurology here. And that's like it. That will do
Yeah.
like pediatric
Well, the
patients.
only good thing I can
And
tell
that's where
you
like I had to go.
is that Nemoris is opening more and more clinics now, like all
Hmm.
over. So I don't know if they'll make it to New York, but I'm hoping they do because they really are needed in a lot of states that don't have these
Yeah.
places for these kids to go to get these specialists.
Yeah.
They just don't have them,
Like
and
there's a
it's
couple
sad.
of like I know of like a couple places that I think there's 2 or 3 that I know of that do like inpatient um, psychiatric centers for kids that
Mhm.
like really struggle in the household. Like there's like 3 of those I know, but not great reviews. And
Hmm.
then like I feel for those parents that there are a lot of parents that can't have their children in the house because they
Yeah.
become dangerous siblings or themselves and they really
Right.
do need that
Yeah.
24/7 care. But
Yeah.
then they're afraid to send them to these places because you read the reviews and you're like, I don't want to send my kid there. Like,
Yeah. It's
as a
scary.
parent, you're like, I got to protect my kid, but like, I have other kids to protect. It's like
Yes.
such a hard thing. They definitely need safer places for kids to go and like get the
Well,
treatments that they
you
need
ready for
without like
here?
having to,
For here, it's an
yeah.
8-year waiting list. 8-year waiting
Oh my
list
God.
to get them into a facility like that. So we don't have those here. No.
That's crazy.
8-year waiting list.
Wow.
Yeah. Yeah, because
That's crazy.
there's a couple kids that I know that my therapist has that are psychopaths. They're psychopaths, and
Yeah.
they are a danger to have in the house. So they need to be in these facilities, and they can't send them to the facilities because so all they could do is keep
I
getting
hear
them
that's a thing in a
distracted.
lot of states.
Yeah.
I just watched a documentary actually about that. Natalia Grace,
Yep.
the
I
girl
seen
that
that
the
too.
family had adopted,
Yep.
and they kept trying to get her into in treatment, and they
Yep.
wouldn't keep her, even
Yep.
though they said she was like and at this point, after watching the documentary, I don't think it was her at all. But when they made it to the point where they're like, she needs to be here, they just kept throwing this girl out.
Yeah.
I think that girl was really manipulated, especially after
Yeah.
hearing like she really was just a child.
Yeah. I know.
Um,
That was
but
sad.
that's sad.
Yeah.
Yeah, it's
Yeah.
sad to think
It's
that
8 years.
that is an
Yep.
issue. Like places will keep kids. So it's
Yeah.
like,
Like,
what happens now? Like you actively try to get your kid into a place because you knew they were dangerous to themselves and others, and then
right.
they're like, well, it's an 8 year wait list. By that time, the kid's older, they can commit a murder.
Yep. Yep.
And then like whose fault is that?
Exactly.
You know?
That's why this country needs way more. We need way more things available for mental
Right.
illnesses. It's just
Like we
not,
talked about the shootings, the
yep,
school
the
shootings
school
with these
shootings.
kids.
I know. Yeah,
Like
it's
if they were treatment center, like how many of those could have been issues that we said that the one parent was doing everything that they needed to do, but like the community clearly wasn't.
nope.
What if it was a case like that? Like they wanted to try to get that specific person into an inpatient facility or get like help, and they weren't able to get it, and it results in shootings.
Yep.
And then the
Yep.
nation's like, oh my God, another mass
Another
shooting.
one.
Like, what are we going
Yeah.
to do? And it's like, the answer's in front of you. Like, we need more mental health resources.
And they keep talking about it, but they're not doing
They
anything.
don't
And
do
it just keeps
anything.
happening. It's like you're talking about it, but you're not doing nothing. I don't see them doing one thing about it. And it's really sad, but that, like you're saying, there isn't enough facilities. None of the states have enough. None of them.
Mm-mm.
And the other thing is that too, there's not enough awareness. There's not enough talk about it,
Right.
like what we're doing. So that's another issue. And then there also is like other facilities too, like for when they do get older too. Like,
Mm-hmm.
like, like, what if my kids get, I'm hoping this doesn't happen, but it could be in the back of a parent's mind. Some children grow up and with the autism, they can't take care of themselves. They can't,
Right.
they're not able to
Mm-hmm.
go grocery shopping for themselves or take care of themselves with hygiene or anything like that. And then
Mm-hmm.
they
Right.
constantly are needing their parents. Well, what if happens to me and Gordy and we're too old and we can't even do it anymore? Those facilities are 8 year wait too, where they actually can go into a
Exactly.
home like that and get the help that they need, and people can assist them, take them to the grocery store, take them grocery shopping, making sure they're cleaning themselves, making sure that, you know what I mean? Because there's all kinds of other
Right.
things that can happen because of the
Yeah,
psychological.
a lot of people with autism when they get older in those situations too, they need like an in care, whether it's like at a facility or like in their own home. They need somebody to maybe come and help
Yes.
them with day to day. Like we do have facilities that do that, but now with like the healthcare crisis and like not having enough doctors and nurses,
Yeah.
you're not going to have nurses that can go to places, or even like aides. Like
Yep.
there's a need for aides. I see the hiring signs everywhere. Like they
Yep.
need personal care aides,
Yep.
and like they're not
And that's
there.
just for elderly people. It's not even for kids
Right.
like my kids or that they may
Right.
need it when they get older. It's like I mean, if they don't even have enough now, it's going to happen years from now. I mean, because they're just not
Right.
addressing all the issues that there are, and there's so many, so many. I mean, we could go on
Yeah.
forever.
Yeah. We did a wraparound service for Bryson when he was younger, and we had like three different people, and we needed the referral first of all. So we got like a referral from the psychiatrist, and I had to like go down to this building and fill out paperwork, and they were like, "Yeah, he qualifies for like a wraparound service." And like, so he had like a care coordinator who like organized the stuff for him. And then we had like a behavioral interventionist that came and like spent a couple hours with him every week. And then there was this other, I can't remember what his title was, but he would come in and he would teach Bryson like how to cope in the real world, and like would take
Mm,
him to out places and be like,
hmm.
this is how we act in public
Right.
type of person. And the idea of it was really great, but the problem that we found was they had never seen a kid like Bryson. Like the behavioral interventionist who specialized in behaviors with kids, big emotions and stuff like that. He was
Right.
like, I don't understand him. Like, it's very clear he's smart enough to know, like what he should be doing, but it's almost like something stopping him. Like he just doesn't have that capability. Like he could verbalize like answers to things when he was asked, like, what should we do in this situation? He would say it, but he couldn't physically do it.
Oh.
And so it ended up kind of being like a flunk. So I
Mm,
feel like I go back to like, people are not educated enough in every aspect of things, which I don't always expect them to be, but
right.
there should be people that are like,
Yeah.
if you only work on one mental health issue, then that's what you do. But like,
That's what you should be
you need
doing. Yeah.
like a specialty team that, Bryson has a lot of different things going on.
Right.
So he needed somebody that would be able to understand all aspects of that. And it was great. The idea of it, I love the idea of it. I'm like, oh man, this is gonna be so great. But like after we spent time with these people, it was just like he really wasn't learning anything.
That's what happened to us with the ABA therapy. Um,
Yeah.
they came in, and what was happening was they would come into the house and they would be here for 4 hours. Not even lying to you. They'd be here 4 hours and they'd be watching him and seeing all the behaviors and everything else. But then it got to the point where they were telling us how we should be parents. And
Oh
I was like,
no.
nope,
Mm-mm.
this isn't going to work. I'm
No.
like, because if you're going to sit here and contradict me in every move I make and every little thing that we say, then I am not going to do this because I can understand there being a little bit of a curve there,
Right.
but you're not going to completely change me, completely change everything that we believe in and everything that we see fit for our children and how they should be in society and how they. No, you're not going to do that. And it just got to the point where I was getting so frustrated that I was telling the therapist, and she was
Yeah.
therapying me because she was like, "You're not the first parent to tell me that."
Well,
She's
it's like
like, "You're
I'm
not
all
the
for
first
like
parent."
people giving me advice. Like, well, we've seen like this be effective in children that we've worked with prior. But if the parent is sitting there saying, well, we've done similar
You've done
things
it.
and that doesn't,
Yeah. Yeah.
they're like, well, you're not doing it right then. And I'm like, no, like, I can't tell you how many different therapists have told me to do a rewards chart with my kid. I'm
Yeah, it
like,
didn't work
he
for us.
does not care.
They don't
Like, he
care.
doesn't care to put a freaking sticker on a chart. And they tried doing that with him this year. Like,
Yeah,
he
they don't
is
care about
12. Do
that.
you think he cares about a freaking
No,
sticker?
no, no.
Absolutely.
He's too
What?
old for
Oh,
that.
I got a sticker. I got a sticker this week for being good.
No, they don't
What?
care. No,
What is that? Like,
mm-mm,
give him
no.
something he wants.
That's
Like,
crazy.
absolutely
Yeah.
not. Like,
Especially at his
he
age, I
would
can't even
never.
believe they were saying that.
Right. But that's like something a toddler would maybe do. Like we
Yes.
did those
When they're
charts when they were
really,
like potty training
yeah,
chart, and you
potty
got a
training.
sticker,
Yeah.
and they
Yeah.
loved it. Like I'm like my 12-year old is not gonna be like, oh my god, I'm gonna have
I got a
zero
sticker.
outbursts this week, and I'm gonna sit in my seat and I'm gonna pay attention and I'm gonna participate and be the world's best student. And at the end of the week, I get a sticker. Like what?
No.
Like, he doesn't want that shit.
No, no, because they were doing that when they were in school. Well, not well when Elijah was in school. His teacher, what they did is they had a treasure box, and then he would be able, if he
Mm,
was good all week, then he got to go in the treasure box and he got to get something out of the treasure box. Well, it
like
came
a
to the point
pencil.
where the treasure box was no big deal anymore, and he could care less if he got something from that treasure box. So I was like, this reward system thing is not working. It's just
Yeah, he
not
saw
working.
everything in that damn treasure box. He was like, I have all that
Yeah.
at home. I don't want that crap.
Exactly. I don't want that. Or this is a piece of junk and I don't want it. You know
Yeah.
what I mean? Was not working. No. Not when he
Yeah,
had
they
bigger
want,
and better
it has to
things
be
on his
something
mind.
they want. Right. Like, they want some, like, that people don't realize how hard it is for them to like behave.
Yeah.
Like it takes a lot of energy out of them, a lot of self-control which they don't have, and then to
No.
get rewarded with something like so minuscule like that, it's
Yep.
like
Like today,
my kid definitely
Elijah told
wouldn't
me,
want a pencil either.
yeah, like he told me today when he got in that argument with Chloe and everything, I asked him straight out, I was like, why don't you try to be nicer? Why don't you try to let it go? And he goes, I am trying to, mommy, but I can't help it. So
Yeah.
he's telling
And
me,
that's true.
I
Yeah.
can't help it. Yeah.
Yeah. And they know I mean, for the most part, most kids are self-aware of their capabilities.
Yep.
It, it's frustrating because they can't always communicate. Like to us, we're like, you can do better. And they're like, I really can't.
Yeah.
And they get so upset by it.
He's
And
always telling me
that's like,
there's always something that pushes him not to want to. He doesn't
yeah.
want to. He doesn't feel like it and he
Yeah.
doesn't want to. And I'm glad
Right.
he's telling me that, and
Yeah,
and
at least he's vocalizing it.
yeah, and the therapist just keeps telling me, he keeps telling you that, but you just got to keep stressing to him, that yes, you can. You are in control of your
Yeah.
emotions. Don't let your emotions control you. That's what she always tells him.
Yeah.
And because he's old enough, he's not that he's old enough, but he acts old enough and he's so mature for his age that we can talk to him like that.
Right.
Like if I can tell him situations for his actions, like what could really happen in the real world, and what could damage him, in the long run. You're going to either end up in jail, Elijah. You're going to end up either shot, Elijah. You're going to end up in a really bad place, Elijah, if you don't change the way
Yeah.
you're acting now. And that's why mommy and daddy are
Yeah.
here. And that's why we're telling you
Yeah.
these things.
We have the same conversations at our
You
house with
have to.
really with all of our kids.
Yeah,
Yeah.
it's
And I
reality.
try to like explain that to him constantly, but um I know he gets it,
Yeah,
and I keep trying to tell people like when he's put in certain situations, like he just can't help the way he reacts at
right.
all. Like especially like at school because it really is such an overstimulating environment for
Well,
him.
yeah. Mm-hmm.
Um, sometimes like you know, as hard as he tries, and I've had teachers say like we can see him physically trying to like keep quiet and like keep to himself, but like you can almost see it like starting to boil up in him, and it just comes out, and then he's like, and he knows like I shouldn't have just
Yeah.
said that or did that or whatever it is, and when you ask him about it, he's like, I didn't want to, but I just had to, and like there's been so many people who are like he could totally help it, and I'm like, listen, I'm telling you, you'll be able to tell if that's the case because when he's at home, I can tell when he's struggling to not do something and when he's
Mhm.
purposely doing something just to be a jerk. Because,
Yeah.
yes, kids
Yeah.
can be
Oh,
jerks.
yeah.
Kids
Absolutely.
will choose to do
Mm-hmm.
things they know they should just to get a reaction. But there are also times when they really can't help it. They know deep down inside, like, this is wrong, I shouldn't do this, but it's
Yep.
still going to come out. And,
Yep.
like, you have to have empathy for those kids
Yes, you
that
do.
are trying.
Yep.
And it's not just them being jerks all the time. Sometimes it
Right.
could be like a 50-50 thing. Yeah, 50% maybe, yeah, he's doing it to be a jerk and get a reaction because it is amusing to them.
Yeah.
But
Yeah.
the other 50% of the time, it's like they can't help it and it
Nope.
does look bad. But
Mm-hmm.
like like put yourself in their shoes. How frustrating it is for them to
That's what I
know they
try to
shouldn't be
do.
doing it and they
Yeah.
can't do it.
Yeah.
Yeah,
That's
I
what I
can't even
always try to
imagine.
do. Yeah, I can't
Could
either.
you imagine like yourself as an adult, like you're put in a situation and you do something like you can get in a lot of trouble for, and you just do it anyways because you couldn't help it. Like with OCD, like I have OCD, there are things that I have to do, or it
Right.
makes me more anxious.
Yeah. Yeah.
And that's like what these kids live with too. It's
Mm-hmm.
like I had to do it. I was anxious. I had to let it out. I knew it was wrong.
Yep.
I knew it was stupid. I say that to my therapist all the time. Like, I know these things that I do are absolutely off the wall stupid. I'm the first to say it. Like, this sounds so ridiculous when I say it out loud. I think it's funny that I have to do it. Like, it's humorous
Right.
to me, but like, at the
Yeah.
same time, my brain's like,
But you
do
have
it
to
or
do
you'll
it. Yeah.
die. Like,
Yeah.
that's what it's
Yeah.
like, you
Uh-huh.
know?
Yep. Yep.
And that's like these kids are like the same. It's
They
like the same
are.
thing.
They are. Because
It's
I
like
mean, we
it's
could
the
sit there so
anxiety
many times.
aspect of it.
Yes. Because there's so many times you could sit there and say, don't do it. Don't do it. Like I'm constantly saying that to Elijah. Don't do it. Because I know what he's going to do next. But don't
Mm-hmm.
do it. Because you're going to be in more trouble than they are. Don't do it. He still has to
Yep.
do it.
One
It
hundred
drives
percent.
me nuts. But it's like,
It's like you
he
see
knows
toddlers
it.
that do that when they're like 2 or 3, and you're telling them like,
Hmm.
"Don't you throw
Don't
that cup
touch.
on the ground from
Or
their own
don't
height."
touch.
They look you dead in the eye and they do it anyway, and you're like,
And they do it
"Oh,"
anyway.
and
Yes,
it
that is.
doesn't go away. It doesn't. It
No,
really
no,
doesn't.
it doesn't. No, not with
It's
them at
so
least, because that's
weird.
what they're
No, it's,
thinking, And a lot of
I
it's
always say to
attention
Bryson, like
too,
at the
though.
top, yeah, it is attention. Oh my
Yeah,
god, it 100% is.
yeah. Because
Bryson
I
doesn't
noticed
care what
that.
kind of attention he gets as long as he's getting
As long
attention.
as
Like
he's
if it's
getting
bad
it.
attention, he doesn't care. He's
Yeah,
getting
it's
the
Elijah.
attention.
Yeah,
I wish
that's
that he
Elijah.
would care and like want the positive attention, but he
Right.
doesn't care as long as like I'm like it's me, especially like when it's me. I
Yeah,
don't really think he could care less if it's any other adults, but like he wants my attention all
that's the
the
Elijah
time
too. Yeah, Elijah wants mine
and
too
wants to
all the
hug
time.
me and
Hmm.
yeah.
Me too. Me
Whereas
too.
anyone else around him is like, meh, whatever.
They're
So
mama
it's
boys.
it's yeah.
They're mama boys.
Oh yeah.
Yeah, that's
Bryson
how
says all
Elijah.
the time. I'm like, you're 12, Bryce. You can't be like hanging all over me, wanting hugs and like mommy kisses. I'm like, it's starting to get to the age where it's getting a little strange. You can't be like kissing you on the lips anymore.
Yeah.
Like I just can't. He just doesn't get it. I'm like, it's weird for me as an
Yeah.
adult kissing my
Right.
almost teenager on the lips. I'm like,
Right.
he craves that. He
Yeah,
wants
that's
it. I'm like, I will hug you. I will kiss you on the cheek. You can kiss me on the cheek, but I gotta put a limit to like the
yes.
mouth kissing.
Yeah.
It's too much for me.
Yeah.
Like it's
Especially
I
that
don't
he's
know.
12 now. Oh God, I'm wondering if Elijah's going to do that because he does that now.
Right,
He's 10.
right.
So it's only 2 years away.
But I see my parents. I don't kiss my parents.
No.
Like I'll
But
kiss my mom or dad like on the cheek and give them a hug. But if I went up to my dad or my mom and kissed them on the mouth, they'd be
I
like,
know.
"What the hell
What
was
is
that?"
wrong with you? I know, right?
Yeah. So I'm like
Yeah.
trying to teach Bryson now, like you're getting older. This
Yeah.
is not socially acceptable anymore. You're not like
Yeah.
a cute little 5-year-old who's kissing their mom
Right.
goodbye for school
Yeah.
anymore. You're you're hitting puberty and it's now
They
it's
just
weird.
want it for so long, though. Isn't that
Yeah.
crazy? It's like it
It
just
is.
never
It really is.
ends.
He would like sleep with me if I let him. If I let him like sleep in bed with me still, he would totally do
Yeah.
it.
Elijah would too.
And I'm like,
Elijah
nope,
would too.
mm-mm.
Yeah. Yeah.
Cuddle
Me
me.
neither.
I'm like,
But
you're as big
Elijah
as I
would
am.
too.
We're like the same height.
Yeah, no, mm-mm. Yeah, it's just crazy how much they cling to the moms, like the boys. I don't know.
Mm-hmm.
It's just
They're
really
like a safe space, but they're also the worst behaved for us too.
Oh yeah,
It's
absolutely. Yeah. Like he
it's
doesn't
so
behave the
weird
way
how
he
that
does for
works.
me, the way he does with Gordy. He's not the same. He's not the same.
Right? Bryson's the same way. So like, Bryson's father lives in a different house,
Right.
but like, he behaves completely differently for his father than he does for me. Like, he could be a total monster with me, and I'll tell his dad, and he'll be like, he doesn't do that here. And I'm
Wow.
like, well, that's annoying. But he
Yeah.
also doesn't want to like hug all over his dad either. He
Well,
wants to
no.
do that to me.
Yeah, yeah. Like he doesn't do
So,
that with Gordy either, like Elijah. He just does it with me. And it's just
yeah.
I don't know. It's just crazy.
It's
There's
like
so many
Leighton's the
different
same way. She's really clingy. She's I call Leighton my Velcro child
Oh my
because
God.
it's like she's attached to me at like Velcro. Like she wants me to hold her hand and give her hugs, but she can also be like a real jerk. And I'm like, I don't want to hug you right now. You're just screaming at me
Right.
for something, you
Yeah.
know? And
Yeah.
but then like my stepson is completely opposite. He is so awkward if you try to hug him. Like he does not want you to
Um,
hug him.
who
Like he'll
does not
do
want?
it, but you could feel like
Yeah.
the tensity in his arms when he does it. Like he
Yeah.
doesn't want to be doing this at all. So
Yeah.
he's like
See, that's
completely
Elijah.
opposite. Like
I mean, that's not
care
Elijah. I mean,
less.
that's Shay. Shay is like awkwardness. And then I'm her mom. And, even with her dad, like she'll hug us and stuff, but it's on
Yeah,
her terms. It always has to be on
yeah.
her terms. If she wants it, when she
Mhm.
wants it, that's just the way it is. And she's always been
Yeah.
that way. She's just not my cuddly,
Yeah, that's
she's not a
good.
cuddly type. She doesn't like to be
Yeah,
cuddled. She
Hunter's
doesn't.
cuddly with his mother. Like, she'll definitely like still want to like cuddle with her in her bed and watch movies and stuff. He would never do that here with me or his father. Like if we go to family members and you're like, okay, go give Nana and Papa a goodbye or whatever. He's like,
Right.
and like he like will hug them, but like his head will be turned away from them while he does it. Like he looks uncomfortable, but that's just how he is. Like
Yeah.
he doesn't want affection, and we accept that, and we're like,
Right.
do
Yeah.
you want a hug goodnight?
You
And he's
have
like, no, I'm
to.
fine. We're
Yeah.
like, okay,
Yeah. I like,
you're fine. Like,
yeah, like I have, like Shay'll just come up to me if she wants a hug or, and then she'll hug me first.
hmm
Everything's got to be first with her. She'll do it first,
yeah,
and I know. But like, she used to never go up to the therapist and like hug her. Like she talked to her just fine, but it was just
yeah.
talking. But now, like in the past year now that she's hugging her now. Like she'll hug her,
Oh,
but it's a gentle hug. It's
yeah.
like kind of like not really hug hug, but like, I'm hugging you, so, but this is all you're getting. You know what I mean? Like not like
Yeah,
that huge embrace hug,
yeah, like a
like my other
trust
kid.
hug.
Yeah, yeah. Like I like
Yeah, I,
you and that's it.
I always like Bryson and Layton will make me hug them before bed every night, like to go to sleep.
Right.
And I'll be like, Hunter, do you want to hug goodnight? And he'll tell me no. And I'm like, okay, well, I just want to let you know that I do want to hug you, but I'm not going to because you don't want me to. Like, I make sure
Right.
like it's
Yeah, that's
his
good.
choice. Like, I don't want to
Yeah.
make you uncomfortable.
Yeah,
And I'm like
exactly.
really big about my kids making their own choices. Like, I
Oh
never
yeah.
force them to do things they don't want to do. It doesn't matter what it is. Like,
Yeah.
if you're telling me I really don't want to do this, I will never force you to do it.
Right.
So, and
Yeah.
that's for any, even like the littlest of things. Like, I won't make
Yeah.
you eat this food if you really don't like it. I won't make
Yeah.
you play this sport or do this activity or go
Right.
somewhere,
Yeah, we had to learn
whatever it
that.
is. I'm never going to force that.
Yeah,
Yeah.
we learned
You can,
that
and you
right
can't. You
away.
can't force that.
No, you can't. Because once you
No,
force
because
them,
you don't
they're
want your
just
kids
going
to
to hate
resent
it and
you.
they're going to be so upset with you and they're just going to be miserable. So it's not
Yeah.
worth it.
Yeah.
It's not worth it.
Yeah, it's not. It really isn't because like they grew up to resent you.
Oh,
Like
yeah.
my parents used to force me to do this, this, and that. Like you don't want that when they grow up. Like
Mhm.
you're not gonna have a relationship with your kid just because you force them to do all of these things.
Yeah, that they don't
Who
want to
wants
do.
that? Like
Yeah.
just because they're kids doesn't mean they don't have feelings. Like people are always like, oh, your kid's in such a bad mood. Like kids are allowed to have bad moods.
Oh my
Like
God,
they're allowed
yes.
to have bad days.
They
Like
have bad days,
everybody's
bad
just
moods.
because they're smaller people. That
Yes.
frustrates the hell out of me that
I know.
people
I
like
hate
don't
when
accept
people
kids
say
having
that.
bad days.
I know. It's like so ridiculous. It's like you were a kid too once, weren't you? That's what I always say. Weren't you a
Right.
kid once? Because, yeah,
And how
didn't you
many
have bad
adults
days?
have horrible days every freaking day?
Yeah,
Like,
exactly.
come on. Like,
Yeah.
I know
Kids are gonna
plenty of
have bad
adults who are in
days
a
too.
freaking mood every day.
Oh, every
Yeah. And I'm
day.
like, come on. Like literally, I do. I know so many adults that are always like super
Yeah.
moody and just like
Yeah.
rotten moods. And
Yep.
I'm like,
Yep.
okay, well, you can't definitely say like kids can't have, kids are just smaller humans.
Yeah.
Like they have all the same
Exactly.
emotions as adults. And those
Yeah.
emotions are
To
bigger because
expect
they
them to
haven't
be in a
learned
good
how
mood
to like,
all the time. Yeah, I don't
right.
understand
Yeah, it's
that.
never going to happen. That drives
No.
me nuts. I hate
Just like when you
that.
have people and you're in the grocery store. I don't know if you ever got this, but we always did. We go in the grocery store or anywhere. We're out with the kids and one of them acts up or something, and then people are staring at you.
Oh my
That
God, I hate that.
really frustrates me. So I have
Hmm
so much respect now, having the kids that I have and everything, that when I go and I hear a kid screaming or whatever, I never turn around and look. I
hmm
don't because I know. I know now.
Yeah,
I
it's
know
like
that.
when a toddler cries in the restaurant, you get all those huffs and puffs. Like, that's a
Yeah,
freaking toddler. Like, they don't know
exactly.
how to regulate their emotions yet. They don't
Yeah.
communicate with words yet. Like,
No.
that's how they express what they're feeling. They freaking cry. Like, get
Yep.
over it. If you don't
Get
want to
over
listen to
it.
kids cry, then you don't go to the restaurant.
Yep.
Like,
There's been
families shouldn't
times,
have to not do things.
yeah, there's been times when I've seen like parents struggle in the store with, and the kid's autistic, you could tell. And
Yeah.
then the kid's throwing himself on the floor and this and that, and the poor mother's trying to grocery shop and trying to give attention to him and trying to make him stop and whatever. And it's like, go up to her and ask her, "Do you need help?"
Yeah.
You know what I mean? Instead of staring and making your observations and then saying something horrible. Go up to them,
Yeah.
ask them, "Do you need help? I can help you. What do you want me to do?" You know what I mean?
If we
Anything.
if we would
Because I
all
heard
just
there was
stop
one
judging.
story out there where this woman went and she was in the store and she saw the mom struggling with an autistic child and she got down on the floor with the autistic child and just started talking to him and just started talking nice and smiling and got him to calm down when the mother couldn't and helped that mother. That's what she did. She saved that poor mother, calmed the child down, and everything was okay. And then they were able to go on their merry way. That one little thing helped that mother
Yeah.
so much in such a big way
If
that she'll never
if
forget
people
it.
would just do that, right? Like if
Yes.
more people are compassionate and rather than judgmental, that mom was probably so close to just leaving her cart and just leaving the store.
Oh,
Like
yeah.
that saved her, you know. And what's more frustrating than having to continuously go back to try to finish a task?
Yeah.
You know, something as
Yep.
simple as grocery shopping.
Yeah.
Like I think
And I
about
mean,
that all the time.
people have to go out with their kids all the time to do stuff. I mean, they don't have
Right? There's not
babysitters. They
people
don't
who
have things like, yeah. And it's just like,
exactly
yeah, you people
single
just,
parents don't have other
yeah,
people.
exactly. And it's like, you just have to, you know, not be so
Like
mean
show
and
some
ignorant.
grace.
And,
Like
yeah, show some grace.
yeah,
Exactly. That's perfect. Show some
that's the
grace.
big
I love it. Yes.
literally
Yes. All right. Well,
so
we'll stop
frustrating.
it here. What do we want to talk about next week?
I was thinking I would like to talk about medications because
Yeah, I think that's
we
a
kind
great
of
one.
talked about it a little bit, and that's one of our biggest struggles in our household is having to take medication.
Yeah, ours too. So, yeah, that's a good one. So we'll talk about it and we'll talk about the different ones that our kids are on and then yeah, go from there.
Ones
Sounds
that our
good?
kids have tried and the symptoms that or
Yes.
side effects that came with
Side
taking.
effects.
We've had a lot of
Yes.
those.
There's a lot of those,
So,
yes. That sounds good. All
all
right.
right. Well, till next week, guys. Thanks for
Yes.
listening.
Thanks for listening, everyone. See you next week.